Very good afternoon, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing. And I'm sure all of you must be doing good. Today, we are going to discuss about our skin health with focus on psoriasis. Now, psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. And as you all know, in today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Satish Nauhria, who is an MBBS from GMC Jammu, DDN STD, post graduation from GMC Amritsar, and the director of Blossom Skin Hair Laser Clinic, Ludhiana, Punjab. A very warm welcome to you, Dr. Satish Nauhria.
Thank you, ma'am, for.
So, doctor, as today we are going to talk about psoriasis. सबसे पहले तो psoriasis क्या है? What is psoriasis, doctor?
Psoriasis is a Greek word. Psora, isis. Psora is itch, and isis is a condition. So it is a very itchy condition. Psoriasis is a chronic, long-lasting, inflammatory, proliferative, autoimmune disorder characterized by patches of abnormal skin, clinically presented as raised red patches covered with silvery white scales. Most common is the plaque psoriasis, that is in the 90% of cases. Others are gutted psoriasis, palmoplantar psoriasis, nail psoriasis, pustular psoriasis, and inverse psoriasis. It is affecting 2 to 3% of the population worldwide. It is not contagious. Aspid sign is positive in this, and Kovner phenomena is also there.
Right. So, doctor, as you said, it is an autoimmune condition. So, are there other reasons or causes for psoriasis?
Basically, it's a exact cause of psoriasis is unknown and not fully understood. It is a combination of the genetic immune dysregulation and the environmental factor. So our immune system is overreactive. Mistakenly, it attacks its own cells, raising skin cells turnover. We have to understand what is skin cell turnover. Our skin undergoes a continuous process of renewal where old cells are shed, replaced by the new one. It takes about 28 to 42 days, and younger adults, it slows down with the age. Newer cells are produced in the deeper layer, move upward to the surface. Eventually, they shed off as dead cells. This process is faster in psoriasis, just you can say 5 to 7 days. Another role of T cells. T cells, their type of lymphocyte, WBC, plays a crucial role in the immune system, which is very important for the defense against the infection and the disease. They develop from the stem cells in the bone marrow, mature in the thymus. T cells are essential for both cell-mediated and humoral immunity. In psoriasis chronic inflammatory condition, T cells plays a crucial role. These T cells interact with the immune cells and keratinocytes, contribute to the overproduction of normal maturation of the cells, leading to the psoriatic plaque.
Fair enough, doctor. Doctor, who gets psoriasis? Any risk factor for psoriasis?
Anybody can, basically, age factor is anybody can get psoriasis. Anybody. But there are two age groups. They peak two peaks, 25 to 40 years and 50 to 69 years. Both sexes are equally affected. Nowadays, I have seen a case of a 2-year child having the psoriasis. So anybody can have psoriasis anytime in their life.
Right. Doctor, when a person comes to you with such, scaly, itchy patches on their skin, are there any tests that you normally recommend for proper diagnosis, or just by physical and clinical investigation, you're sure that this is psoriasis?
We examine the patient clinically and see the things, what are the sites involved, what type of patches are there, whether this is a fungal infection. We have to clarify ourselves. It could be a fungal infection also. Okay, there is something inverse psoriasis is there that affects the groin and armpits area. You can say people they confuse in the fungal infection and psoriatic patch. So we have to differentiate. Clinically, it's a we see look for the aspid sign when there is a large patch. It's aspid bleeding occurs when we remove the scales. Pinpoint bleeding is there. So we
Okay.
see the cognitive phenomena. What are the sites involved? What are the we all the see the clinically. And in the institute level, we can do the biopsy also to differentiate from the other problem. But in 99% cases, we diagnose the patient clinically.
Okay. Right. So, doctor, what happens in our society, with the skin? I guess we are a little lenient. We experiment a lot on our skin and skin related issues, be it acne, be it fungal infection, be it anything. So, what happens? We'll go for some home remedies in case we see something on our skin, or we'll go for OTC products, or we have so many influencers these days on various social media platforms who have, something or the other, the whole DIYs, home remedies for so many skin related issues, and people fall for it. Plus, these days, market is flooded with products. They claim so many things. People again fall for it. Is this the same in case of psoriasis as well? People come to you after experimenting a lot with OTC products, etc., and when everything fails, then they approach you.
Ma'am, it's very clear when the patient is coming to us for the treatment, he must have used the product from they have taken from the chemist shops or drugs like that. The
Mm.
steroid creams. What treatment we advise for is when the patient is one problem in psoriasis I have seen in my 40 years experience.
Mm.
The patient comes and if he is getting relief after you can say 1 month or 1.5 month, 2 months, he never comes for the follow up. Never comes. He leaves the treatment, and that's why again there is a lapses are there, flare up. So patient again coming. Patient education is must be. You have to go to a dermatologist every 1 or 2 months interval, and proper follow up is a must for a patient. Patient they are leaving all the treatment. Obviously, a lot of treatments are available for the psoriasis. Lot of treatment available. Now the latest we are doing wonder in the psoriasis. Still there is no, we cannot claim that it's a completely cured. I will tell you one example. One of the IPS officer came to me with a scalp psoriasis. He said it be there. I have got it checked from many hospitals. Doctor, no treatment, and you are not doing anything. Psoriasis, no treatment. But I first get the checkup and come to the clinic. He was psoriatic scalp patches on the scalp. So second, I came to know he is a diabetic patient and overweight, 100 plus kg weight. So I told him to have a reduction of the weight, diabetic control nahi hai. Alcoholic, you are an alcoholic, and smoking, you are doing it. So you have to stop other things. And after the gap of 2, 3 months, he said it, I am completely cured. I don't know. It's a psychological, it's a counseling. You can say counseling is a must for all the patients. They are not taking it.
Counseling is very important. तो बॉटम लाइन है, अगर सोराइसिस हुआ है तो घबराना नहीं है, जितनी जल्दी हो सके डॉक्टर के पास जाना है, डॉक्टर यानी क्वालिफाइड डर्मेटोलॉजिस्ट. प्लीज डोंट फॉल फॉर स्टेरॉइड बेस्ड क्रीम्स. या कई बार ये भी होता है हमारी सोसाइटी में, तो डॉक्टर, आई एम श्योर यू हैव आल्सो सीन अ लॉट ऑफ such cases where our relatives or friends who have gone through it, will pass on their prescription to others कि मैं तो गया था डॉक्टर के पास, तुम भी चले जाओ, मैं तो डॉक्टर के पास ही गया था ना, तो ये prescription तो है, तुम भी यही use कर लो. So this is also a very common practice. But as doctor is saying that, OTC products, steroid-based creams, etc. are a big no-no. Please go to the correct person, which is a qualified dermatologist, get it treated. So doctor, psoriasis, is it completely curable?
Ma'am, this is basically, you can say it's not curable, but if you give the proper treatment, proper follow-up, and symptomatically you can manage the patient very well.
Okay.
If patient is coming to you for the treatment, the patient has improved very well. The person who is coming regularly to a dermatologist for the treatment and after a gap of 2 months interval, you can see. So definitely he's getting relief. And so we start with the treatment. We start with one treatment, local treatment and systemic treatment. In milder cases, we start with the you can say local treatment only, topical. And in you can say moderate cases, we start with the systemic treatment. Common treatment, we start with the local treatment, and first we see the response. What is the local steroid, moisturizer, acid, many vitamin D cream, calcium cream. So we see the effect after a gap of anti-allergic. We have to control the itching. So we have to see all the things. Otherwise, we start the treatment, but treatment is a very, very lengthy treatment. If we put the patient on, you can say we start the patient on the methotrexate. Methotrexate is very commonly used nowadays for psoriasis. And second, you can say cyclosporin use करते हैं. And methotrexate के लिए first we have to get all investigation done for LFT, CBC, and all the renal function test. Whether there is something wrong somewhere, then we start with the local treatment and methotrexate. Weekly treatment is given. It's very good. It's up to 20 milligram we can give very safely. It's very safe. The patient responded very well after. Then you have to continue this treatment for 1.5 years. Reducing from 20 milligram to 10 milligram, then 5 milligram 6 months, the patient leaves the treatment. This basically cyclosporin is another wonder drugs for this. It is basically attacking that it's affecting the T cells. T cells, so that inflammation is reduced and overproduction of the cells is reduced. So costly drug, patient don't purchase. Another now apremilast is giving the wonder drugs. You can say biologics, apremilast tablet is there. So usme patient is not regular for the treatment. Patient is taking treatment, leaves the treatment, go to another doctor, then RMP, quacks, and other things. Patient is not regular. We are sometimes we are frustrated from all dermatologists. The patient is not coming, what to do? Even I have started psoriasis clinic, the patient is not coming. Once a month, patient is not coming to check up.
Right. And that's why, as initially doctor said, counseling plays a very important role. Please go to the right person initially, that is a qualified dermatologist, and trust your doctor. That's very important because it will take time, but of course, it's a very easily manageable thing. So please don't ignore the part of going to the doctor as soon as you spot these signs of psoriasis. Doctor, what is the role of moisturizer when it comes to psoriasis?
Moisturizer, ma'am, is basically it's giving a soothing effect to the body. It's infiltrating the stratum corneum. The dryness is the one thing. Dryness is a very, very, you can say, very common. Patient is very dry skin, itchy. Itching is also controlled with the moisturizer. And moisturizer we mix with the topical corticosteroid. You said it's a topical corticosteroid. Must be potent corticosteroid. Clobetasol use करते हैं along combination with the sometimes we use the combination of the calcium combination. So we see the results after that. Moisturizer, topical steroid, and other. Then there are certain creams also. Certain, you can say, added salicylic acid creams, urea, potar creams are available. We see the effect of the things. If there is no improvement after 1.5 months, in milder cases, improvement is there. In moderate cases, we have to start the systemic treatment. उसमें commonly we use methotrexate and cyclosporin. Costly methotrexate is very cheaper drugs available in the market. Patient can afford well. And methotrexate has got side effects. I have told you earlier. Also, we have got all the investigation done, and we have to start with the folic acid along with it. Methotrexate inhibits the enzyme, जो कि folate deficiency हो जाता है body में, तो उसमें iron deficiency हो जाता है. Then we added the folic acid tablet along with that to prevent that. So this is commonly we are using.
Yeah. Doctor, I wanted to ask, does sun also helps? Because, many times we have seen people with psoriasis saying that let's, spend some good quality time under the sun.
Sunlight basically very important. It's very helpful, particularly UVB rays. It's a very beneficial role in the psoriasis. Brief exposure can reduce the symptom, like slowing the skin cells growth, reducing inflammation, and there is increased production of the vitamin D, which is very helpful. Sometimes vitamin D deficiency patient, they have got trigger the psoriasis, triggering effect of vitamin D. And we give the sometime at the institute level in some of the bigger hospital with PUVA therapy. We started with the PUVA therapy, light therapy. Soralen, take soralen orally and exposure to UVA light, sunlight. Afternoon is the best period. But that is also not acceptable to the patients. Now there are other lights are available, UV lights, broadband and narrowband. They're available in the market. You can say that their lamps are available, UVA. In some of the lamps there are combination. UVA, you press the button, UVA aa gaya. UVB aa gaya. But that is in the localized psoriasis patches, you can say. If you want to expose the whole area, then you have to go for the PUVA therapy or the PUVA chamber. PUVA chamber you have to do.
Right.
The precaution is to cover the eyes. It can damage your eyes, retinal damage. Right. Good role.
Okay, doctor. Doctor, we have also heard about psoriatic arthritis. What is that?
Psoriatic arthritis is basically inflammatory arthritis. You can say this symptom like joint pains, stiffness, and swellings. Even in the milder cases of psoriasis, there is a significant degree of arthritis in there. It's very common even in milder cases, psoriatic arthritis.
Right. We are also getting many questions regarding psoriasis from our viewers. Deepak Saxena is here and his question is, kya psoriasis genetic hota hai?
Yes, ma'am. There is genetic. Definitely, there is a role of genetics are there. I already told it's a genetic multifactorial. The genetic is one parent is one of the one is affected and 50% chances of the kids are affected. And genetically, we are getting the cases. We are getting the cases. Father is having, son is having. Genetic definitely plays a good role in the.
Right. So, in case there is psoriasis in the family, doctor, what should one do, especially the newer generation? What should they do as a precautionary measure? Do they need to go and consult a dermat even before they see the signs?
Yes, first they should notice something that if they are in the younger age group, there is some gutted psoriasis is very common in the younger people. Even in the after sore throat infection is there is some lesion on the gutted type lesion on the body. They have to consult a dermatologist, then he can make a diagnosis. Otherwise, it is drug rash. People they are making drug rash. They started steroid and all the things. Isme there is you have to consult a dermatologist if there is some problem. Otherwise, there is a diagnosis is very confusing, always. So, wrong treatment is always given. Wrong treatment.
Tanishka Rajoria है हमारे साथ. उनका question is, scalp psoriasis different from dandruff?
Definitely, ma'am. Dandruff is basically seborrhea.
Huh.
Psoriasis is very patches on the scalp, and you can say it's a psoriasis vulgaris cases. Psoriasis may other sites are involved. That's hands, you can say elbows, upper part of the trunk, lower back, other parts are definitely involved in the psoriasis. Psoriasis scalp means very few cases only psoriasis scalp, but that is a localized patches on the scalp, localized crusting with crustal lesion on the scalp. In seborrhea, in you can say dandruff, they diffuse. It is a diffuse all over the scalp. You can see other seborrheic area are also involved, like that post-auricular region. You can say other region, seborrheic area involved.
Okay. There's one more question by Sumit Sen. Any foods that should be avoided if I have psoriasis?
Food, you can say very important. Certain foods, you can say we have to avoid. Dairy products, eggs, red meat, they have got the arachidonic acid in the that trigger the inflammation in the psoriasis. And sometimes gluten is there in some patients they are sensitive to the gluten. Then we advise the gluten-free, you can say diet. Then there is a certain processed foods, nightshade fruits, vegetables you have to avoid. And second is basically you can say I'll advise. इसमें जो I have seen in my life, obesity is the major cause, which is also triggering and giving. Second is a chronic smoker, chronic alcoholic. They got very triggering. You can say it's giving inflammation to the whole body. Their obesity, I have seen all the patients are obese, and they got the you can say insulin resistance and other symptoms are there. Then increase the inflammation in the body. So that gives the psoriasis and trigger the psoriasis. There is major, you can say, worsen the psoriasis also sometimes. So they should avoid all the things, and diet should be very healthy. Diet should be there, and you can take a healthy lifestyle. And another I've noticed stress. Stress is one of the reason. Always under stress, especially always under stress. ठीक तो होना नहीं है. Stress से it releases the आपको you can say जो कि हमारी हाइपोथैलेमिक पिट्यूटरी एक्सिस होती है उसको स्टिमुलेट करती है, उससे रिलीज होते हैं हमारे बॉडी में और डिफरेंट इन्फ्लामेशन हो जाता है स्ट्रेस से. स्ट्रेस वी शुड कंट्रोल आइदर थ्रू काउंसलिंग. स्लीप शुड बी नॉर्मल and patients sleep is 6 to 8 hours a day. Exercise. They should not do vigorous exercise. ज़्यादा forcibly नहीं करना क्योंकि उसमें there is you can say problem triggering of the psoriasis. Mild exercise you can do. Otherwise नहीं. So food, processed food, then I have told you earlier, the dairy products and other things there for the we should avoid.
So healthy diet, a healthy lifestyle, good sleep,
Yes.
good, if you're stress free, that goes a long way in keeping you healthy as well as your skin healthy. And of course, with
Yes.
psoriasis also there is a correlation, So please don't go for alcohol, smoking, or stress, etc. Everything is a part of our life these days. Stress is a part of our lifestyle.
Yeah, yes,
Then you can do some recreational activity to keep yourself as much stress free as possible.
You can
Yes,
do
doctor.
yoga also. You can do the practice yoga and singing also. You can say you can go for the singing practicing. I love singing. I love singing. That's why I have to do. It's a giving mental relaxation. Writing something, you write something on your diary. Right, that is also giving us stress reliever. You can say. If you write
Absolutely.
something.
Everyone has a way, whatever you like, do it and stay as much stress free as possible. Now, doctor, before we wind up the whole session, any take-home message, anything that we have missed out on psoriasis, anything that you would like to tell us before we conclude?
Ma'am, always, I advise always have a proper treatment from a dermatologist, proper treatment and continuous treatment and proper follow-up. Second, I always advise the stress should be less. Again, I'm telling patient को भी advise करता हूँ stress नहीं होना चाहिए. You are going to be cured. If there is no cure, everybody is saying no cure. You are going to be little bit. We have to relax the patient. You are going to be relax तो करो ना. तो उसमें healthy diet, healthy lifestyle is very important. And one patient I have seen, the patient is exfoliating daily in the, you can say, he's going to spending one to 1.5 hours in the bathroom and removing his scales. His scales himself. I told him, you are bluntly giving the injuries to the skin again. How you can improve with that? With all the treatment, he's improving again. Worsen again. हो जाता है इसलिए पेशेंट को यही एडवाइस है you have to go for a dermatological checkup, continuous treatment, proper follow-up, healthy diet, healthy lifestyle.
Right. So please don't experiment with your skin. Don't exfoliate. Don't do anything in case you have any signs of infection or anything. Go to the correct person, which is a qualified dermatologist, and trust your doctor. Complete your treatment. Or in case of psoriasis, of course, it's going to be lengthy, but have patience. You're definitely going to get relief.
Yes.
Thank you so very much, Dr. Satish Nauhria.
Thank you, ma'am.
It was wonderful talking to you, sir. Thank you for your valuable time
a
and
nice
making the
time.
session so. Yes, doctor, please.
Thank you, ma'am. Thank you. Have a good time.
Indeed, a very informative session. Thank you again. And viewers, thank you for your active participation. So, to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead.
Yes.
Goodbye.
Thank you, ma'am. Thank you. God bless you.
Thank you, doctor.
Thank you.